The branches of maxillary nerve. In the cranial cavity, it gives a meningeal branch to the meninges. So in the pterygopalatine fossa, it gives three branches: the ganglionic branch, the zygomatic branch, and the posterior superior alveolar branch. So we'll see one by one. So this is the ganglionic branch, two branches, ganglionic branches, on which the pterygopalatine ganglion hangs. So second is the zygomatic branch, this one, dividing into zygomatico-temporal and the zygomatico-facial. Third is the posterior superior alveolar branch, this one, posterior superior alveolar branch. So ganglionic, zygomatic, and posterior superior alveolar. So next, in the infraorbital canal, it gives two branches: middle superior alveolar and anterior superior alveolar. So here is the middle superior alveolar, and this one is the anterior superior alveolar. This is another picture we see. This is the middle superior alveolar, and this is the anterior superior alveolar. And in the face, it arises as the infraorbital nerve and divides into a palpebral branch, a nasal branch, and a superior labial branch. Here we see palpebral, nasal, and superior labial. So these three branches supply this part of the face. Sensory supply to this part of the face. So here we see the whole part of the maxillary nerve. First part, in the cranium, in the cranial cavity, it gives a meningeal branch. Secondly, in the pterygopalatine fossa, it gives ganglionic branches, the zygomatic branch, this one, and the posterior superior alveolar branch, this one. Then in the infraorbital canal, it gives two branches: the middle superior alveolar and the anterior superior alveolar, this one. So then in the face, it gives three branches: the palpebral branch, the nasal branch, and the superior labial branch. So this is the pterygopalatine ganglion hanging from the maxillary nerve, but the maxillary nerve is just the structural component of the ganglion. The functional component is the facial nerve here, this one. From here arises the greater petrosal nerve, and it joins the deep petrosal nerve arising from the sympathetic plexus around the internal carotid artery and forms the knot of the pterygoid canal. So from this ganglion arise several branches like the nasal branches, orbital branches, greater and lesser palatine nerves, and the pharyngeal branches. So the maxillary nerve gives sensory innervation to the orbital part and this part of the nasal cavity, this part of the palate, and this part of the nasopharynx behind the auditory tube. This is the auditory tube, opening of the auditory tube, and behind its opening the sensory supply is from the maxillary nerve. Now next comes the mandibular nerve. The sensory root from the trigeminal ganglion enters the foramen ovale and joins the motor root to form the mandibular nerve trunk. So here this is a sensory root, big sensory root, and a small motor root. They both join and form the mandibular nerve trunk. Now the otic ganglion, this small ganglion, is sandwiched in between the nerve trunk, this one, and the tensor veli palatini muscle. This is the tensor veli palatini. This nerve trunk, this otic ganglion, is sandwiched in between these two. So here the trunk gives two branches. One is the meningeal branch, and second is the nerve to medial pterygoid. This is the nerve to medial pterygoid, and this is the meningeal branch, or the nervus spinosus. So this nerve to medial pterygoid gives two branches that pass through the otic ganglion uninterrupted. One is the branch to the nerve to tensor veli palatini, this one, another to nerve to tensor tympani. this one. So they don't relay here. So then it divides into a small anterior and a large posterior trunk. Here, this is a small anterior trunk, this one, and a large posterior trunk, this big one. So here we see a small anterior and a large posterior trunk. From the anterior divisions, 4 branches arise: deep temporal, masseteric, buccal, and nerve to lateral pterygoid. And from the posterior division, 3 branches arise: the auriculotemporal, inferior alveolar, and lingual nerve. Here we see the picture. This is the auriculotemporal. Here is the inferior alveolar. Here is the lingual branch, joining the coratympanoid nerve. So this is a nice picture showing all the divisions, all the branches of maxillary nerve. Here the nerve enters the foramen ovale and comes out, gives a meningeal branch from the trunk and a nerve to medial pterygoid. So 2 nerves from the trunk. Then it divides into a small anterior division and a large posterior division. From the small anterior division, 4 nerves arise: a masseteric nerve, a deep temporal nerve, a nerve to lateral pterygoid, and buccal nerve. And from the large posterior division, 3 nerves arise: auriculotemporal nerve, this is the inferior alveolar nerve, and here is the lingual nerve. Now here is the submandibular ganglion hanging from the lingual nerve. This supplies the secretomotor fibers to the salivary glands, submandibular and sublingual salivary glands. So the preganglionic secretomotor fibers arise from the facial nerve through the coratympanoid nerve. So from the facial nerve nucleus, the preganglionic fibers come and it pass through the coratympanoid nerve from here and join the lingual nerve and relay at the submandibular ganglion, and then from here it supplies the salivary glands. So as we complete the course of the nerve, let's come to the test of the trigeminal nerve. So to test the sensory function, first let's have a look on the regions it innervates. So ophthalmic branch supplies this part of the face, maxillary this part, upper jaw, upper lip, and this part of the cheek, and the mandibular nerve in this part of the face. So starting with fine touch, take a wisp of cotton and touch it gently on the ophthalmic, maxillary, and mandibular regions of the face and ask the patient whether he can feel the sensations equally on both sides or not. Repeat the test with a pointed object to test the pain sensations. To test the corneal reflex, gently touch the cornea with a wisp of cotton and observe for reflex blinking. So to test the motor function, we'll test 3 muscles: temporalis muscle, masseter muscles, and the medial and lateral pterygoid muscles. Tell the patient to clench his teeth and note the tone of the masseter muscles and the temporalis muscles in the left side and in the right side. Now to test the action of lateral and medial pterygoids, tell the patient to open his mouth against your resistance and move his jaw from side to side. And I thank Dr. Saraswata Mohanty for being my subject. Thanks for watching.